The Prime Minister of Eswatini, Africa's last absolute monarchy, has died here in South Africa. He was receiving medical attention in a hospital after testing positive for COVID-19. He was 52. Ambrose Dlamini was hospitalized earlier this month, 2 weeks after testing positive for the coronavirus. Dlamini announced in November that he had tested positive, but said he felt well and was asymptomatic at the time. He was moved to South Africa on December the 1st to fast-track his recovery. He was a businessman, and despite being a political novice, he was named Prime Minister of Swaziland in October 2018. Now, the Eswatini government says with the family, it will keep the nation informed about the subsequent arrangements. Well, for reaction now, we're joined by the president of the Swaziland Democratic Nurses Union, Mr. Bheki. Mamba joins us now from Manzini. Mr. Mamba, thank you very much for your time. Firstly, your reaction to a sitting head of state in your country dying of the coronavirus.
Thank you very much, my brother. We want to react, my brother, by saying we want to send our heartfelt condolences to the family of the Right Honorable Prime Minister and relatives for the sad loss that the country has experienced.
Yes.
We are very much, saddened by what we have had of late. We are hoping that he was going to make it, since he had been transferred now to South Africa.
Yes, but Mr. Mamba, despite what you are saying, and of course, at a time like this, it's important that the country pulls together. But in a statement that has been issued by your union, you are saying that the Prime Minister, unfortunately, has neglected the health system and patients in various hospitals, opting to seek medical treatment in South Africa. Talk to us more about the state of the healthcare system in Swaziland.
My brother, the healthcare system in Swaziland is seriously challenged. When we are saying it is seriously challenged, we mean to say it has reached a stage where it is unworkable. We are in short of drugs, we are in short of equipment, we are in short of human resource. To an extent that at some point, my brother, we are even short of fuel. Nurses have to, fuel government vehicles on their own pockets if they want to transfer a patient from one facility to another. We have reached a stage where we even don't have sometimes food for inpatients in our facilities. And we have been, begging around shops to donate food for our inpatients. And that is very unfortunate, my brother. And that is why we are saying we were seeking an engagement with the Prime Minister as somebody who is the head of government, to see how can we address this serious challenge.
Yes. At first, it does appear that he was treated in Eswatini at the Siteki. I suspect that's a hospital there. Confirm for us what kind of a health facility this is, and whether, as a result of, I guess, it not being up to scratch, that then prompted the Prime Minister to seek medical attention in South Africa. How do you think this also looks for citizens of Swaziland, that a sitting head of state has now died in another country?
Well, the Lubombo Referral Hospital, my brother, is a referral hospital in one of our regions, the Lubombo region. And that is the facility which had then been assigned to take care of COVID-positive patients. And that is the facility then where the Prime Minister was transferred when it was then discovered that he was experiencing symptoms. But we appreciated that because we had the understanding that the Prime Minister was going to experience firsthand the situation in our facilities, to an extent that he was then, going to, implore to Cabinet to take serious measures in addressing the challenges that we are faced with. But we were amazed that he was then moved from that facility to South Africa. And that was a disappointment to us because it then meant that the whole head of government, had no confidence in our own facilities in the country. And in fact, he was actually saying he does not believe that our facilities in the country are capable to treat patients with COVID-19 at a time where we are experiencing an upsurge of the cases. And it was not bringing hope to the people of this country.
What about the king? What would have been his reaction, if any, when a head of state in that country was transferred to another or to a foreign country to seek medical attention? Was there any response from the kingdom?
We did not receive any response from the king in that regard, but we were expecting that the king would have pronounced himself in terms of what does this mean to us, to the population of this country, and what does it mean to us who are working in the health system in terms of our healthcare system. And we're hoping that the king would rise and then give hope to the people of this country that indeed the government has not neglected their right to medical attention, their right to public health system that is functional and effective and able to respond to any calamity that is before it.
And in terms of arrangements, in a statement, the Deputy Prime Minister basically stating that the country will be made aware of the arrangements from here on. Are you aware what those might be? Basically, what is the process from here on?
No, we are not aware, my brother. Nothing has been communicated to us, except to say we have seen a statement released by government to indicate that the Prime Minister is no more. And I think that is all that we have for now. We hope that maybe as time goes, the Deputy Prime Minister will pronounce the position of government in as far as that is concerned.
All right. Bheki Mamba, President of the Swaziland Democratic Nurses Union, thank you very much for your time reacting to his country's Prime Minister, Mr. Ambrose Dlamini.